Good morning.
Good morning. Well, there we go. Belinda, can you hear me?
I can hear you.
Excellent. Let me turn it up a little bit. Oh, so can the dog. Turn it over here. And the door's closed. Okay. Good morning. I'm Dr. Tim Bagwell, Public Administration and Policy Analysis faculty at Lincoln Memorial University, Harrogate, Tennessee. I am with Belinda Gunning, MSW LCSW this morning, Executive Director of Behavioral Health Alternatives in Wood River, Illinois. By background, I should disclose that I have known Ms. Gunning for over 25 years, and we have worked together to develop software for her agency in the late 1990s. Unfortunately, that software is no longer active due to technology and mission changes. Director Gunning, welcome to Lincoln Memorial University, our class on strategic communication and healthcare. Director Gunning.
Thank you for having me.
Oh, sorry. I just roll right through. Thank you very much. I'll just, okay, is it okay if I call you Belinda?
Yes.
Yes. Belinda, tell us a bit about yourself, how you entered the profession and eventually became the leader of your organization.
I entered the profession just by accident, really. As a young person, I wasn't really sure what I wanted to do, tested out a few things, and social work stuck. So I went and got my bachelor's in social work and began working. Was encouraged to get my MSW. I, never thought I would go back to school, but I did. I'm glad that I did. Got my MSW, and then later on, I got my LCSW, and here I am.
Excellent. And how long have you been in the field?
Actually, in 2 more days, I'll have 30 years here at Behavioral Health Alternatives.
Oh my goodness. I've never been 30 years anywhere. Moving along here, now to your organization, Behavioral Health Alternatives. How was it created? How long has it, how has it changed and evolved? And what is the mission today?
So we've been through lots of changes. It was established in 1984. And it was mainly an after-hours counseling or hotline for the 2 other mental health centers here in Madison County. We eventually grew to having the hotline actually for all of Madison County, which meant that we also pre-screened for any admissions to the state-operated facility, plus answered after-hours calls then for several other counties in Illinois and in Missouri. After several years of doing that, the state decided that they would divide the county up, and the 2 larger mental health centers took over the crisis line, and the state had us develop a geriatric psychosocial rehabilitation program, and that entailed working with people who were in the nursing home who also were diagnosed with mental health issues. And we did that for several years when the state determined that, hey, they already pay the nursing homes to do that. So they were no longer gonna pay us to do that. So then we moved on to providing case management services. So we currently provide case management services to adults who have been diagnosed with mental health issues, and we assist them with kind of activities of daily living, teaching them skills to manage their mental health, and just ensuring that they have what they need to be part of their community.
And that's what you're mostly doing now.
That is 100% of what we are doing now, and we are a fee-for-service. So the funding has changed over the years. Initially, we are grant-based, and then over the years, it has slowly changed to fee-for-service. So we have very limited grant funding.
Okay. Who are the key stakeholders to your organization that you must communicate with, and how frequently do you have to communicate with them?
So we have several stakeholders, but probably the most communication is with our board of directors. Other people that we have to communicate with are the Department of Mental Health, and the Department of Healthcare and Family Services. So that gets a little confusing because one guides us on what or how we provide services, and then one pays us. So with the Department the Department of Mental Health, we have limited contact, but our most recent contact was probably 4 or 5 months ago. They came out and audited our records, which I'll be happy to report that we passed. It's a pass-fail, we passed, so awesome. The other stakeholder is the Healthcare and Family Services, who contract with managed care companies. So actually our contact with Healthcare and Family Services is more through the managed care companies, and it's really limited contact with them. None really as far as supervisory, as far as auditing. They can come in and audit us at any time. It's more through, they also employ what they call care managers. So we kind of coordinate services with the care managers there. Of course, other stakeholders then would be our consumers who come in and receive services. So there's a variety of ways that we communicate with them. Obviously, they have appointments with their care managers, but also I post PQI reports, which is performance and quality improvement reports, for them to see, satisfaction surveys. And also we want to communicate things that are going on at the agency. So we do have a Facebook page that we utilize to for information to our consumers and to the public. And that's probably one other stakeholder that we have to report to is our accrediting body, which is the Council on Accreditation. So the state requires that you're accredited to be able to get any type of funding, whether it be grant or the fee for service. So every 4 years, they come out to review all our policies, procedures, review our charts, and then approve or disapprove it. So actually the last, this past summer, we were audited by COA, and again, we passed. So that's great news. And that's
Go ahead.
our stakeholders in a nutshell.
Thank you. Couple questions. The CO, that last one, the accrediting agency, is that a state accrediting agency or is that a national?
That is a national.
And most of the other stakeholders you've talked about, other than the consumers and the board, are state agency type stakeholders. Is that right?
Yeah. Yep.
Okay. Just to clarify that a little bit. The structure of your board, is that all local people? As I recall, there's some limitations on who can be a member of the board.
So it is all local. They serve as the individual person, not as their, like our board president happens to be a Madison County Sheriff's deputy, but he serves as himself, not necessarily as a sheriff. We do look for a variety of professionals to be on our board to obviously provide good input and help managing the organization.
So they're kind of part of the communication with the community then, in a way, with
yes. Hopefully, when they're out and representing their professions, that they're also representing behavioral health alternatives.
Excellent. And good information, I think, for people to know. So this class is about communication strategies in healthcare. So now I'm going to ask a question that is maybe a little bit more formal. Do you have a formal plan for communicating with your stakeholders? And if not, how do you, go ahead.
Not necessarily a formal plan with the state people. They get a hold of us when they need something. I mean, I do have contacts that I can reach out to if I have questions, but there's not any requirement for any formal communication, unless, of course, like the agency is going to merge with someone or closing, or there's, issues, then they would like to know those things. The most formal communication is with the board of directors. So I have an agenda that I need to follow, which includes a financial report and a director's report. Are the two things that are most common in that. The financial report, obviously I provide them with the accounts payable, accounts receivables. They get a profit and loss statement. They get to know the balances in the bank accounts. So that's a very important part of the communication, in that they're making decisions on how to spend money. So they need to know what money we have and where it's coming and going. The director's report, I do have certain things that I put on that director's report that helps them to make decisions of where the agency is going as far as services, or other things that we need to do, whether it's to search out other types of funding. So I include on there any contact with the other stakeholders, like HFS or the Department of Human Services. So I do update them on things like that. I update them on any grants or anything that I write, or any contracts that I sign. So here recently, SIUE got a grant to develop a training program for people who have recovered from mental health, who want to be like peer-to-peer providers. So I just
SIUE for my students in Tennessee is Southern Illinois University at Edwardsville. There's one of my students who would know that, but the rest would not.
Right. So I did sign a memorandum of understanding with them to be able to be part of that program. So that's something that I would report to the board. Any contracts that I might sign gets approved by the board. So these are all things that I would report to them. Any fundraising activities, I update them on any risks, which would include just anything that could happen. So I update them on our insurance policies and all that. We do have a formal plan that I have put together for, say, something would happen to me, that this is everything they would need to know to run the agency is in a formal document and has been shared with them. So that's probably the biggest communication we have. Here recently, we have worked extensively with one of the managed Medicaid providers in working with a client. So that's probably the next thing that comes up is coordinating services with other providers.
Thank you.
And that's really, it's not a formal process because it just kind of happens, and
we have a lot of things in place already, especially with the board, that defines how you communicate with the board. Is there a limit on the size of the board?
So the board has to be at least 8 members and cannot exceed 15. Our bylaws state that we meet as often as needed for the good of the agency. So typically we meet 10 months out of the year. We try to take July off. And July is because on June 30th, we're ending a fiscal year, and July 1, we're starting. So there's not a whole lot to report then. And we're trying to get 1 year closed out and 1 year started. The other month that we try to take off is December for the Christmas holiday. But if necessary, if anything is going on, then we obviously will meet those months.
No, thank you.
We do have, I'm sorry, and I'm at a loss for words of what I want to say. We do have policies and procedures for how the board is set up and ran, the number of committees, who's on the committees. It's kind of a guide of what they do.
All these board members come from Madison County, Illinois? Is that
Yes.
how that works?
Yes. So we
Madison
always
County-
try to have a lawyer on the board, not that she can give us any legal advice. We always try to have someone from like a pastor or minister on the board. Obviously, we want some business people on the board. We always try to have a police representative on the board. So we just try to keep it a variety. We have a Madison County board member on our board. So we just try to keep a variety of people.
Madison County, of course, for my students, is located across the river, what we call Metro East area in the St. Louis metropolitan area. And Madison County is one of the larger counties. That the population confuses either 250,000 or 500,000. About what size is the county population?
That's probably right, about a quarter, maybe a little more. And the interesting thing about it, it is rural and urban. So it's a rather large county.
And has a long history with Alton and the Granite City and the steelworking, the steel mills there, oil refinery business, university there. So it's a very diverse county. I know there's there are trial lawyers there that have a lot of money. And so it's a very
Yes, there's I don't know if I should say, it's a lot of people like to come to Madison County to sue. It's a generous county, I should say.
very interesting, very interesting.
Which does impact us in a way, in that we have to buy liability and professional insurance. So always in Madison County, that always costs you a little bit more.
Moving ahead a little bit here, just reflecting back, what has been your most challenging episode or episodes that you're willing to discuss and share with us here?
I think the most challenging over the years has been funding and having to change and adapt to our funding sources. So, but I feel like the state has changed what we do over the years. But I feel good about that, in that they just didn't stop our funding. They felt that we were an organization worth continuing, and that we provide a good service, and that we are still here today. But definitely the funding has always been, at least in the last 20 years, has always been an issue. It's always a struggle.
Now, your agency is unique, I believe, in that you're a standalone. You're not part of a system. I know there's like Chestnut and others
that is true. There's 2 other mental health centers in the county, and they are much larger than us. So that creates a challenge for us, in that our main focus is mental health, and they do a wide variety of things. But when we discussed, I guess, funding and things like that, probably 15 years ago, I asked the state then, where do you see us? And they were like, that they were amazed that we were able to be a standalone organization then. And that's about the time when the 2 other mental health centers in the county did go with much larger systems of care, and that they're also located in other states. So we're behavioral health is it. We're 1. We have 8 employees, 6 full-time, 2 part-time. So you want to talk about communication challenge. You think that would be easy to coordinate our staff meetings and things like that, and that we're not very many people, but that's a challenge.
more employees at one time or another, though, right? Seems like.
When we were doing crisis and pre-screening for the state operated facility and answering after hours for other counties in Illinois and other counties in Missouri, we probably had between 35 and 40 people employed. So just with the loss of that contract and moving on to other things, we have just over the years just downsized.
No, but it has still survived. And
And yeah, it survived. Yes,
yes,
we're
yes.
fighters. I would, to say that, I think we're very fortunate in that we are small, so we're kind of family oriented. Everyone here, the least tenured staff here is 5 years. And then I think we have like 8, 11, 13, about 3 in the mid 20s, and then me with 30. So I think we provide quality care because we've been here and we know what we're doing. I know the other 2 facilities struggle to keep staff. So I'm very fortunate in that.
Excellent, excellent.
And that's
excellent.
probably because, communication is good at a smaller organization. I think once you get so big, people feel left out.
Yeah, I would think. What is your advice to anyone managing a regional mental health center, which I think you may have already given in some way, but is there something in a nutshell?
It's definitely diversify your funding, search for those grant resources. And I won't lie, it's a struggle. So for a smaller organization, we get probably, I'm gonna say maybe 5% of our funding is grant based. And that is actually to help fund one of our positions to provide services for people who don't have insurance. So.
Excellent. Closing, what was your advice to anyone interested in joining the field of mental health counseling and services?
I think it's a wonderful field. There's definitely a need out there. If you're going to go into the mental health field, definitely make sure that you have your own coping skills. You'll hear a lot, and it's changed. It definitely has changed my view of the world to understand most of the people that we see have been traumatized in some way and traumatized by other human beings. So you kind of it's a double-edged sword in that you get to help people and help them do better, but you also hear about what other people are capable of doing to another human being. And that, so definitely it can be rewarding, but it can be very challenging.
You need a lot of resilience. So,
yes.
Yes.
Yeah.
Thank you for taking your time to share your knowledge with my students. And on behalf of our department, Lincoln Memorial University, I want to say thank you. This was a great interview.
Good. I'm glad to share my experience. And, if there's any follow-up questions, reach out.
All right. Thank you.
All right.
Bye-bye.
Bye.